and whoever not given for intro, so it's not a problem. Just you can speak up, guys. Otherwise, you can text here. Okay. So if you have any issue, just set before itself when you are going to attend the sessions. Okay. So anyway, guys, thank you, and it's very good evening. And coming to myself, so this is Harish, and totally I have a 10 years of experience in multi-speciality. So I have a ED facility experience and ED prophy and ENMIP, ENMOP, and gynecology coding and infusions and injections. And I have a experience in somewhat in denials also, denials and edits. So I worked all over this multi-speciality projects. So totally I have a 10 years of experience. Okay. So myself, Harish. Thank you guys. And I'm going to start the session. So just listen carefully. If you have any doubts in between, just you can raise. Okay. Thank you. So shall I start the session, guys? Are you ready?
Yes, sir.
Yeah. So guys, now we are going to discuss ENM. So what is ENM? Generally, ENM is nothing but evaluation and management. Okay. So what is, first of all, everyone should know that what is the define of evaluation and what is the define of management. Okay. So what is evaluation and management? So evaluation. So the coming to first one, guys, evaluation. So evaluation is nothing but when patient came to the hospital. Okay. So when any patient came to the hospital with the any symptoms or any illness, okay, already is facing some symptoms. Okay, so because of that problem, he came to the hospital. So after came to the hospital, the physician will evaluate the patient and patient will we have a document is there generally. So like HPI, ROS, PFSH, and physical exam. Okay. So in this process, the physical evaluation with the specific manner. Okay. And okay. So what is HPI? What is ROS? We will discuss later, guys. So evaluation is nothing but when patient came to the hospital in a specific manner, the physician will evaluate the patient in each and every system. Also, he will evaluate and he will finalize the diagnosis. So after evaluation got completed, so he finalized the diagnosis. In this evaluation process, so he collect the information. In HPI, what they mention, whatever patient is said, that only they will mention in the HPI. So in the patient words, what he said. So I am facing from last 2 days onwards, nausea, vomiting, diarrhea. Okay. So like this patient will say. So that only they will mention in the document. And next one, ROIs. So ROIs is nothing but review of systems. Okay. So ROIs is nothing but review of systems. So in this review of systems, we have a total 14 elements are there. So 14 elements is nothing but system wise. So later I will show you the document also after the session. Just listen, guys. So this ROIs also, it is a questionnaire type. So physician will ask a questions system wise to the patient and patient will give you an answer. So if nothing is there, they will mention as a normal, respiratory system normal, cardiovascular system normal, like that. If any issue is there, if patient is saying something I have, so just whatever the problem is there, that only they will document in the ROS, each and every system. So in this ROS, we have a 14 elements are there. Okay. And next one, PFSH. So generally PFSH we can call it as a fish also, guys. PFSH is nothing but we can call it as a fish. So what is fish? So PFSH, post medical history and surgical history is a one element, and social history is one element, and family history is one element. So whatever the already patient have any chronic conditions, already surgeries, any surgeries got happened for the earlier for the patient. So that and all they will document in the post medical history. Any chronic conditions are there and surgical history, any surgeries got happened, that things they will mention in this post medical history and surgical history. And next one coming to family history. So family history is nothing but if patient father have a diabetes or patient mother have a hypertension, so that type of things they will mention in the part of family history. Okay. And next one, social history. So social history is nothing but, guys, if patient have any habits like smoking habits or any drug use disorders or any drug abuses, or patient is a lack of income, or patient have a homelessness, or patient or patient have any sexual related disorders, or patient is uneducated and patient is unemployment. So this type of things comes under socialist. Okay, so any smoking habits or any drug use disorders. So these things under comes under the socialist. Okay, so this is the one specific manner, guys. We have a document is there, HPI, ROS speech, after that physical exam, after that MDM or assessment plan. So we can call it as a assessment plan or MDM. So the next one, physical exam. So guys, physical exam is nothing but generally this should be done by purely by physician only. So each and every system physician will examine of the patient and he will mention in the system wise. So patient have this problem and patient may have this problem or this system is normal. That should be purely done by physician only. In physical exam, we have a 12 systems over there. So like we can call it as a 12 elements. So whatever the systems physician need, sometimes they will evaluate 12 systems, sometimes they will evaluate 5 systems, sometimes they will evaluate 10 systems. Okay, that should be based upon patient condition and physician needs. So that should be purely done by physician only, guys. So this is the process of evaluation. Okay, so in evaluation, when the physician is going to evaluate the patient in a specific manner, he will evaluate the patient, and after that, after evaluation, he finalize the diagnosis. So this is nothing but evaluation. So any doubts on this, guys? Till now, are you getting something? Just give me response, guys.
Yes, Harish. No
Yes.
doubt.
Yeah.
It's clear.
Yeah, thank you. So, and coming to the part of management. So, what is the definition of management, guys? So, management is nothing but, so after finalize the diagnosis, so based upon that conditions, physician is going to physician is going to order some medication, like any prescribed medication or any OTC medication, or is going to order any labs, okay, CBC lab or CMP or hepatitis panel or COVID panel. So some labs he is going to order or he is going to prescribe any medications. Okay, and if based upon patient condition, is going to order any procedures. Order means is going to plan for procedures based upon patient condition. Is going to plan any minor surgeries or major surgeries. Okay, so that should be comes under the port of management. So management is nothing but based upon patient condition, physician is going to order any labs or any imaging reports like X-ray, CT, ultrasound, or EKG, or physician is going to prescribe any medications, or physician is going to order any infusions, injections, or physician is going to plan any surgeries. So these things comes under the port of management. So that should be based upon condition. Physician will do the management part. Okay. So any doubts on this guys still now? ENM. So what is evaluation and what is management? I think everyone got understand the definition. Right. So, and generally, guys, we are going to so in ENM, I am going to cover ENM IP and OP. Okay. So both the topics, what we are going to billing the services in ENM OP and ENM IP. So each and every topic I will cover. So some I am going to show you the slide. Right? Are you seeing right? So what are the topics I am going to cover other than this? See, 1995-97 guidelines. So generally we have a 1995-97 physical exam guidelines is there, guys. But right now we are not following that guidelines. But anyway, the basic things I will take the session. That topic also I will cover. Okay. And next one. So see here ENM, OP and IP, annual wellness visits, prolonged services, preventive services, and TCM services, and critical care services. So these things, each and every topic we will discuss in detail on daily basis. Okay. And same day admit discharge services for IP. Okay, and initial visits and subsequent visits. What are the updates got happened in 24 and 25? Okay, and 23. So generally, guys, the basic thing is ENM mainly depends upon as per 2023 updates based upon MDM and time. So these two are the key elements. MDM and time is going to play a major role in the ENM billing services. Okay, so we are following for ENM CMS guidelines. So what is CMS? Center for Medicare and Medicaid Services. So that guidelines only we are following for ENM, IP and OP. Okay, so for ENM services, like for ENM is nothing but guys, we can call it as a professional services. So professional is nothing but physician billing. So we are billing to the physician. Okay, whatever the services we are billing, that revenue will goes to the physician side. So that only we can call it as a professional services. Okay, so procedures also I will take a session, guys. Minor surgeries and some major surgeries also we are going to bill, and infusions, injections, and vaccines, modifiers, so modifiers and MDM table. So generally, guys, earlier we have a some different concept is there, but that concept we are not following right now. Only based upon MDM or based upon time only we are billing the services. So in 2023, so many changes got happened in MDM. Okay, so we have a MDM table is there, guys. In that table we have a three tables are there: table A, table B, table C. Okay, in that also so many changes got happened in 2023. Not so many drastical changes got happened in 2023 in MDM table. And 24 also we have some updates on split share guideline services. So that topic also I'm going to cover you guys. Okay. 1 minute, guys. I'm going to share next slide. So generally, guys, these are all basic things. Just listen. So these are the key components earlier we have: history, physical examination, and MDM, counseling, coordination of care, nature of presenting problem, and time. But as per 2023 update, only MDM and time is the key elements. MDM and time is the key elements. So as per 23 update, history and examination they removed as the key elements. So this is the 2023 main update, first update. What they did now? Earlier we have we considered history elements and physical exam elements. Based upon that also we considered levels. But as per 23 update, history and physical examination they removed as a key elements. Earlier we have these also key elements are there: history, examination, MDM and time. But in 23, history and examination is not. So history and examination they removed as a key elements. So guys, someone unmuted. Any doubts? Clear, right, guys? Shall I move on?
Yes, sir.
Yes.
Yeah, okay, thank you. So, guys, history is nothing but, so what is the history part? What is history consists of three things. One is HPI, the second one is RBOIS, and third one is PFSH. So these three things comes under history part. So we can call it as a HPI, RBOIS, and PFSH. Okay. So we will discuss HPI. So guys, in HPI, we have a 8 elements for there. So what is the HPI? History of present illness. So chronological description of present illness from initial sign to the present. So in this HPI, we have a 8 elements for there. Okay. So what are those 8 elements? Location, quality, severity, duration, and timing, context, associated signs and symptoms, modifying factors. Guys, these are all basic things. Just listen. Right now, we are not following this concept. So that's what I'm saying. History and physical exam, they removed as a key elements. But when you are going to attend any interview, it will be useful for you. So that's what I'm saying. What are the basic things are there earlier and what are the changes happened in 2023? Okay. So you should know, right? Minimal knowledge we need, everyone. You should be aware of that things. Okay. So first one, location. So location is nothing but guys, when patient came to the hospital, if like right lower quadrant abdominal pain or right upper quadrant abdominal pain or epigastric pain or right shoulder pain or right knee pain. So that one we can consider it as a location from HPI. Next one, quality. So quality is nothing but guys, if patient came with right lower quadrant abdominal pain, so the quality of that pain is they are saying as a mild. Okay, so mild pain or dull pain. So like that they will use. So the term mild or dull we can consider it as a quality. Okay. Otherwise, you can leave this condition. If patient came with a dry cough, So the term dry we can consider it as a quality. Dry, the term we can call it as a consider under quality. So earlier we followed these things, but right now we are not following from 2023 onwards. So don't think too much, just listen, okay? Next one, severity. So severity is nothing but guys, same. If patient came with that RLQ abdominal pain, so that we have a pain scale is there, guys. In that pain scale, we have a pain score that should be 0 to 10. So if patient came with some condition and they are saying the pain score is 5 or 4 or 7 or 8, so that one we can consider it as a severity. Okay. And other than that, if the condition is increasing or worsening or the pain is moderate, so like this type of terms they used in HPI, you can consider under severity. Okay. So the condition is increasing or worsening. So this type of terms, if they used or moderate, you can go with the severity. So next one, duration. So duration is nothing but guys, uh, already patient is facing some problem from last 1 week onwards or from 2 days onwards or yesterday night 11 p.m. onwards. So that is nothing but we can consider under duration. So these elements we have to pick from HPA. So earlier we followed till 2022. And next one, timing. So timing is nothing but guys, specific time they need to mention in the HPA. So if example, patient have that some condition, that condition is raising constantly comes and goes. So just you can go with this right shoulder pain. So that's shoulder pain constantly comes and goes. So constantly means that constantly word we can consider under time. Okay. Other than that, if they need to mention right now, present, so this type of terms also, if they used, you can consider under time. Okay. So next one, context. So context is nothing but guys, how it happens. So patient got some injury or fracture, or patient fall from steps, or patient got stuck in any accident. Okay. Or so something got happened while playing cricket or while playing volleyball or football. So something while he's doing some activity, he got stuck in some way, so while jumping or while running, so the activity, because of that activity he got something. So how it happens, so patient got stuck in any accident or patient fall from steps, so that is nothing but context guys. Next one, associated signs and symptoms. So guys, signs and symptoms is nothing but patient will say, I have a nausea or vomiting or diarrhea or constipation. So this type of things, if they mentioned in HPA, you can consider under signs and symptoms. And last but not least, so that is a modifying factor. So modifying factor is nothing but guys, so patient is already suffering from fever in home at home, so he took some medication like NSAID, acetaminophen or Tylenol. So that is a non-steroidal anti-inflammatory drug, right? So he took some medication in it at home itself. So after he took that medication, he is getting some relief from that pain, some that condition. So fever is a condition, right? So generally fever is a symptom, but it will affect all over the body. So he after he took that NSAID medication, he is getting some relief from that. So that one we can consider as a modifying factor. So this is about elements of HPA guys. We have a 8 elements for there. So clear guys? Anything else? So guys, any doubts till now? Good to go. Guys, give me response now.
Yes, sir.
Yes, ma'am.
Just see, you're not able to speak always. Just I'm only taking the session, but when I'm asking, just you have to give me response, right? So if you're giving response only, I will get energy and I will move on. Otherwise, I will stop over there. Okay.
Hello.
Yeah, Vijay, tell me.
Sir, can you explain duration and timing difference?
So the difference is nothing but the duration is nothing but, so what I said, from if he is experiencing any problem from 1 week onwards or 1 month onwards or yesterday night onwards or last 2 days onwards. So that is nothing but duration. Okay. So timing should be, they need to mention the specific time. Okay. If see, I used one word, right? Constantly. So the constant word you can consider under timing. Other than that, they need to mention right now the patient is experiencing. So right now, that one also we can consider under time. Okay. So
Okay, sir. Thank you.
actually, we are not following that, so don't think about that. Okay. So that type of specific things they need they if they mention in HPA only we can consider. Otherwise, we should not consider other things under time. Okay. So next one, guys. We have a one concept, guys. Generally in ENMOP, we have a one concept. So that's only I'm going to explain you. Generally, what is new patient and what is established patient. So in ENMOP, we have a new patient and established patient concept is there. So guys, I'm going to divide as a 5 points this concept. Just listen carefully. In between, if you are getting any doubts, just you can raise. Okay. So first point. First of all, what is new patient? Okay. So new patient is nothing but guys, when patient is coming to that hospital, if any facility or any hospital, okay. So this is the first time. So if example patient name is A, so that patient is coming to that hospital. This is the first time. Okay. So that facility or that hospital is coming to the first time. So we can consider it as a new patient. So the first point is clear, guys.
Yes, sir.
Yes, sir.
Okay. So the second one. So when patient is going to be established. So we have a specific term is there, guys. 3 years. So the same patient is coming to the same hospital after 3 years. So if the same patient is coming to the same hospital after 3 years, we can consider it as a established patient. So these are the 2 points. When patient is coming to the first time to that hospital, he is a new patient, and the same patient is coming to the same hospital after 3 years. So that one we can consider. Sorry, yes, I got missed second point. So after 3 years, when patient is coming to the same hospital, again he is a new patient only. So when patient first time is coming to the hospital, he is a new patient. After 3 years also, the same patient is coming to the same hospital. Again, he is a new patient only. So these 2 points clear, right?
Yes, sir. Clear.
Okay. And third point. So when the patient is coming to the same hospital within 3 years, okay. So when patient is coming to the same hospital within 3 years, so that time we can consider it as an established patient. Okay. But when you are going to consider this established patient, guys, you need to check one thing. So it is the same department or different department. So I'm going with one example. In January 1st, 2022, January 1st, 2022, patient came to the hospital. He received the services from gastro provider, gastroenterologist. Okay. After 1 year, in 2023, March 5th, patient is coming to the same hospital. Again, he is going to receive the services from gastroenterologist. So both are same department. So that's again we can consider it as an established patient. So when patient is coming to the same hospital within 3 years, you need to check the department. Okay. So you need to check the department guys. If it is the same department, you can consider it as an established patient. Whenever patient is coming after 3 years to the same hospital, no need to check the department. The term after 3 years now, it is defaultly new patient only. So these 3 points clear, guys.
Yeah, I have one question.
Yeah.
The patient will come different problem. So that is new
Different
patient or
problem
established
means you
patient.
need to check the department. Which physician is going to evaluate the patient?
For example, you just know you said first time he visited for gastro,
Gastro, yes.
and after that heart problem. So it is a new patient.
So after that, he is getting a circulatory related condition. He is not going to evaluate it by gastro. He is coming for cardio, right?
Yeah.
So within 3 years, if the department is changed, so first time patient came for gastro and second time patient is coming for neuro or cardio or any other department, nephrology or pulmonology or cardiology or cardiovascular or cardiac EP. So whatever it is, if the department is changed within 3 years, you have to consider it as again new patient. So that is the fourth point I am going to say. but before itself you ask.
One more question. One more question.
Yeah, carry on. No problem. I will be here only.
Yeah. A patient visited one hospital,
Okay.
but same problem. But he visited another problem, another hospital with same problem. So due to the
Got it. Your question got it. Just you can stop over there, okay? Because that point also I'm going to explain after fifth point. Because that question they are asking in interviews. So see, same problem patient is coming for first time one hospital, and again for the same problem he is going to for the different hospital. There also same physician is evaluated, but here you need to consider it as a new patient. Why? Because facility is different, right? Total hospital is different. This physician is evaluating there also, but that hospital is different and physician is same also. Hospital facility is different. So that's what I'm saying, same hospital or same facility. So if the facility also changed, you can go with the new patient only. So don't based upon new physician, don't consider. So that is a different hospital, so you can go with the new patient only. Got it? No.
Yeah. Thank you.
So that question, so many interviews they are asking actually. Okay. Anyway, I think you are aware of that, or I'm not sure. Okay. So you got the doubt now, or are already you are aware of that doubts? I'm not sure. Okay.
No, I don't aware of that question.
Okay. So
Answer.
now only you are getting question
Yes.
doubts. Okay.
What I think is that
Yeah.
different provider, different hospital with the new patient.
See, the fourth and fifth point is that's what I'm going to explain. Okay.
Okay.
So, guys, coming to the fourth point. So, the fourth point is, guys, already within 3 years, when patient is coming to the same hospital, you need to check the department. Okay. So, if the same department, you can go with the established patient. If it is a new department, you can go with the new patient. Okay. And coming to the one more point. So, guys, here already patient is evaluated by neurologist. Okay, neurology physician, and within 3 years again patient is coming to the same hospital. So first time evaluated by the physician name is A, but he also comes under neurology, and next time evaluated by the physician name is B, so he's also comes under neurology only. So within 3 years same hospital, so the patient evaluated by the same department provider, but the physician name is different. So in this scenario, can we consider as a new patient or established patient? So anyone guess the answer?
Established patient.
New patient.
Okay. So Mahesh is saying new patient, but remaining 2-3 members are saying established. Okay. So Mahesh, why you are going with the new patient?
The physician name is different.
Okay. So based upon that scenario, that reason only you are considering as a new, right?
Yes.
Okay. So anyway, guys, that one we can consider as a established patient only. Why? Because in every hospital, in every multi-specialty hospital, for every department, we have a group of physicians will available. Why? Because that physician also comes under neurology only, right? So that physician also comes under same department. So we can go with the established only, not new. Why? Because in every hospital we have a group of physicians will be available. Like, see, if gastro, at least 5 to 6 providers will be available. Shift time they will take, right. They will evaluate the patient. The visits will be their office visits. So for coming under neuro also, we have a 5 to 6 members. Multiple physicians will be available. So that one we can call as a group of physicians. Okay, so based upon physician name, don't consider. So we can go with the department wise only. So that's what we are calling as a group of physicians. So that physician also comes under same department now. Within 3 years, you can go with the established only. So guys, this is about new versus established concept. So any doubts on this concept? Any one of you? Everything is clear?
Sir.
Okay. So guys, generally when you are going to build these office visits in MOP, this new and established patient concept only we have. For new patient, we have a separate ENMs or there. For established, we have a separate ENMs or there. Based upon MDM or time, we have a separate specific levels or there. Okay, but when how we can consider he is a new patient or how we can consider as an established patient? No? We have a old records will be available in software. So when you are seeing the software, we have a records are there. In that old date of service, up to 3 years or up to 5 years also we can check. So already patient have within 3 years a patient have any office visit is there, or if any office visit is there, which physician evaluated the patient, so we can review the documents. Okay, so we have a old records will be available up to 5 years, up to 10 years also it will be available in softwares. But we, for us, no need. Up to 3 years we it's enough for us. So okay, so if any office visit document is there, just click on that and open it. Which physician evaluated the patient, and now patient is coming for which department. So both you can compare and you can consider is a new or established. That's all. That is a simple thing, guys. Okay, so this is about new versus established concept, and I am going to explain one procedure. Just I will show you how we will get the documents of procedure. So guys, this is a laceration repair document actually. So we will get the documents like this. When you are getting procedure documents, headings will be there, guys. Most of the times headings will be there. Rarely we will get a paragraph type. So that time you have to review the document properly and find out the solution. So it is a which procedure, which procedure. Most of the times, 99% we will get the headings will be there. Okay. So this is a laceration repair, and so here see. Face. The location is face, and forehead. They are saying forehead location and the face, and length is 1 centimeter. And type of repair is a simple repair. Generally, guys, in laceration we have a three types of it: simple repair, intermediate repair, complex repair. So everything we will discuss later, guys. Just I am showing you how we will get the documents of procedure. So this is a simple type of repair and forehead laceration. So they area cleaned with saline 1000 ml sterile saline solution, and they applied a tissue adhesive. And this is a one suture material, guys. Tissue adhesive is just like as a band-aid actually. So generally we should not, if they used tissue adhesive or steri-strips, we should not build laceration procedure. If they used any material, suture material like vicryl, acryl, so like the type of any suture materials if they used, so we can uh, build the procedure. Generally, alone tissue adhesive we should not build generally as per general guideline. But anyway, here they closed that repair and they performed the procedure laceration repair. And patient also tolerated the well procedure and no immediate complications. So along with the tissue adhesive, if they used any other suture material, we can build the procedure. Otherwise, it is a, if only they used a tissue adhesive or steri strips, that is a bundled with ENM. No need to build the procedure separately. So that is we have a general guideline. So that one we will discuss later. So this is about today's session, guys. And anyone have any doubts other than this? Because I have 2 more minutes, just give me. Okay. So guys, in modifiers also, I'm going to cover these topics also. We have a ENM modifiers are there, 24, 25, 57, 27, and CPT 76, 77, 78, 79, 50. So just I'm showing here examples. So anyway, we will take a modifier session also separately, and global package or global surgical package. So this topic, and NCCI edits. So NCCI edits also, how we can use the NCCI edits. So that one also I will take the session. Next one, after that, the guys, some once sessions got completed, I will provide some practice sessions for OP and IP separately. And if you are going to attend the interview before itself, after the session, I will provide interview tips and some questions also I will share. What are the questions they are asking in interviews? Okay, so this is about today's session, guys, and these things and all we will provide. So anyone have any doubts other than this? So this is about today's demo, guys. Thank you. And if you have any doubt, just stay on the bridge and you can ask. If no one have any doubt, just you can leave from the bridge and you can inform. The classes is going to start from Monday. Regular batches, evening 8 p.m. to 9 p.m. on daily basis, Monday to Friday.
Will you explain live charts?
Yes.
With the software or just?
Yes, with software only. So guys, thank you then. If anyone have, just you can ask. Otherwise, you can leave from the bridge and you can inform.
Thank you, sir.
Yeah, thank you.
Thank you, sir.
Thank you. Yeah, thank you.
Thank you, Harish.
Yeah, thank you, Mahesh.
Thank you, sir.
Yeah, thank you, guys. Thank you, all of you.